Hey guys, I hope you're all doing okay, and I hope you guys are studying and doing your key terms like I've asked. We're gonna go ahead and finish, start and finish chapter 4 this week. So let's go ahead and begin. We're gonna do chapter 4, performing an EKG. So this is to prepare you guys on how to do an EKG, and I'm gonna go step by step. If you guys have any questions, please post them on the chat, and I can go ahead and answer your questions. Or if you guys need to call me, go ahead and call me. So let's start. Lesson 4.1, preparation for the EKG procedure. In this, the experience should be pleasant for the patient and needs to be done correctly and accurate. The patient needs to be comfortable. They shouldn't be having any unpleasant visits, because then they will talk to the doctor and then you can get in trouble. The EKGs need to be done correctly. Number one, correctly, because if you turn in something that's not correctly, you can misdiagnose, well, not you, but the doctor can misdiagnose a patient and fatalities can occur. EKG must be ordered from a physician, and you would need a requisition form. What is a requisition form? A requisition form is an order that the doctor gives you and tells you that we need an EKG. Just like, for example, when you go get labs and the doctor tells you, oh, we need to get some tests done. Here you go, take this with you to get it done in a lab. Well, that's a requisition form, and we need one for an EKG. And that should be placed on the patient's record file chart and should include, see your bullet points on page 91. So on page 91, we have the patient, what needs to be included is the patient's name, chart number or medical record number, date of birth, the location and date of recording, patient's age, sex, race, and cardiac and other medications the patient is currently taking, weight and height, and any special condition or position for the patient during the recording. So all that needs to be included in the patient's chart. Very important that you get all those medications, because if they're taking any medication that's like for blood pressure or for your heart, and doctor diagnoses something else, that can counteract with the medications. You also need to have the patient's information should be entered in the LCD panel on the EKG machine. So when we get the machine, we need to enter the patient's name. So when that strip prints out, you have the patient's name. You need to make sure that you're prepared and ready. Okay, we need to be ready when the patient is in the room. That means have your materials ready. Have the paper, have the EKG machine, the electrodes, and the wires. Okay, if you're not prepared, the patient's just going to be waiting and the physician can get upset. Okay, so let's keep going. 4.2, communicating with the patient. Always ensure that you are performing the procedure on the correct patient. Very important. You do not want to be taking an EKG on a wrong patient. For example, if we're taking an EKG for mom, let's say an example, right? Let's say mom, but then we take the EKG on the sister. Those are going to be two different patients, and that could be very bad. Always identify the patient by using two forms of identification. You always ask, okay, very important. Ask the patient to state their name and date of birth. You do not go to the patient and say, are you John Smith? Because if the patient doesn't understand, or there's a language barrier, or they're on medication, they're probably gonna say yes. So you always ask, hi, can you please state your name and date of birth, please? That way they tell you their name. Identify yourself by stating your name and your job title. So you always say, when you go in, hello, my name is Anita Toral. I am an electrocardiogram technician. Can you please tell me your name and date of birth? Okay? I hope so far nobody's having any questions.